So what is time-lapse? Time-lapse is a comparison, a clinical comparison of one point in time with another. So that means that I can see changes happening. I'm not smart enough to remember whether a tooth has worn. I'm not smart enough to know if recession has increased, if inflammation has progressed or improved. But iTero time-lapse is. And that means when a patient asks me a question, a tricky question about, has this tooth moved? Is this aspect of my dentition worse? I don't have to pluck an opinion out of thin air. And even if I refer to my clinical records, my black and white words aren't enough. I can look at a BP and see some 2s or some 1s, but they want more than that, and so do I. So when I bring up time-lapse, I can see if something has changed. And if it has changed, that gives me evidence and facts that I should take an intervention, or I should give the patient an option where they can have an intervention. Let me tell you a little story that'll hopefully bring time-lapse to life for you. Patient comes in, standardized checkup. We call it the digital health assessment. We take a scan, we carry out time-lapse, which compares last year's checkup with this year's checkup. What that shows is a change. So anything different on time-lapse shows up red. Red is bad, red means danger. So when the patient sees that, they're like, what's going on there? Why is that bit of my tooth red? And we have a look and we see that he had a little fracture on his lower incisor. He goes, yeah, I did see that. And I didn't know, if we should do something about it. So in that instant, the patient sees the problem and asks for a solution. And I'm not smart enough to remember whether that fracture was fresh or old, but the scan tells me, and it shows the patient that something needs doing. And that's powerful.